Welcome, welcome everyone. I hope you all enjoyed the presentation as much as I did, and we're excited for a really robust Q&A period. So you see right now are the folks you just saw in the video. You're live and in the flesh. We have Linda Starnes and Eliza Williamson, and I'm going to have them kick it off with maybe a couple of opening comments for the Q&A, and then we would love to hear from all of you. Please put your questions in the chat box, or if you like, you could just take yourself off of mute and ask a question. That's fine too.
Great, thank you, Stacy.
Sure.
As Stacy said, I'm Eliza Williamson from the National Institute for Children's Health Quality. I'm a senior project manager here today. And I'll just say that our colleague, Johnny Hollis, sends her regrets. She cannot be with us for the Q&A, but I am joined by my colleague, Linda Starnes. So I'll let Linda introduce herself.
Hey, everybody. It's good to see you all virtually live. And it was fun to be in the chat before with you all. And then it was nice to see some of the comments and questions. And it's especially nice to see some of our colleagues and friends from both NICHQ and my work colleagues with Title V in Florida. So welcome, everybody. So Eliza, how would you like to kick things off? I know there was one question that we had that I tried to answer in chat in quick form. I don't know if the person who asked it, Yolanda, if she is here with us yet. If she's not, maybe we'll hold off on that question about the youth voice, trying to bring in youth voice until she pops in as she's coming our way. But is there anybody else in the chat yet that has a question? I'm not seeing anything right yet. So we might have some questions for you all.
Sure. Yeah, I don't see Yolanda in the chat, so we can certainly talk about youth voice if anyone else has a similar question, but I guess it would be great to learn and see who's here. We asked the question in our presentation, if you have an active QI program within your organization, if and how patient and family partners have been included. I don't know if anybody wants to share some of their experience with us. And of course, if you're thinking of any questions, you can chat and unmute as well.
In addition to chatting your question or comment, please feel free just to take yourself off of mute if you'd like to ask your question or make your comment verbally.
Yeah, we are flexible. And I might, if no one ponies up, I might pick somebody out of the crowd, because I see my friend Ivy Goldstein from Texas, and Ivy was just in a presentation last evening. If you all did not listen to the complex medical care COIN presentation that was held last evening, it was excellent. And it was so supportive of the idea of having family partners and family leaders involved. And there is Ivy. So, Ivy, I'm going to put you on the spot because of last night, especially, much less everything else I know that you do. But would you mind introducing yourself? And then I'd love to know, regarding quality improvement, specifically what you in Texas maybe have been involved in.
Thanks so much, Linda. First, I want to say, well, I'm Ivy Goldstein. I'm with the CSHCN program in our Title V program in Texas. I'm the state CSHCN health coordinator. And I'm also a parent, and at any moment, you might meet my daughter, just depends whether she's camera shy today or not. So this was an amazing project, and you all did a wonderful job presenting it. I'm curious about how the partnership with NICHQ came about. How can Texas, have an opportunity like that? Linda, you mentioned the presentation led by Boston University, the principal investigator for a HRSA-funded project over the past 5 years with 10 state teams, and Texas was one of them. And you know, I've been with my program 13 years. I am shocked when you say 2 years, because to me, whenever our paths cross, you're a giant to me, Linda. And I love when our paths cross and I get to learn from you. But it was having that organizational framework, that, you know, how well thought out this project was before Texas, before the project actually launched. You know, BU put so much thought into developing it. And I think all the work the 10 states did was wonderful. But if we didn't have that framework, I don't know how we would just, you know, out of thin air, be able to do that. So that's really been a big project in Texas. As for other things, I'm not involved in anything with that kind of framework and structure.
Okay, that's fine. But, you know, so you asked.
Sorry if I talk too long.
No. I was just saying, but, you know, the framework was what was referenced by my boss, Johnny Hollis, early on in that, and setting up this relationship. And Eliza, you can chime in, but you were asking how that NICHQ and Florida relationship came to being. But you're exactly right. To have a project, whether it's statewide or multi-statewide, it does take that thoughtful planning and having those aims and the why you're doing it in that framework. Eliza, what would you like to add about how that came together?
Yeah, so I can add, and it was, I think, the relationship between NICHQ and CMS was developing before my time even. We worked with the Florida Department of Health on a similar learning and action network that was asthma focused. I didn't work on that project, but I do know that that is where this CMS Learning and Action Network developed out of. So I'd be absolutely, you know, interested to connect with you if you want to talk more about that offline as well.
I will say that I think Florida chose well in the partnership because it has been vibrant, and we still, thank goodness, have a couple more years to go on this 5-year plan. And interestingly, we're getting ready to fold in yet some more new folks who'll be involved, and that's going to include some family leaders with our Title V office. And so we're excited about then the growth that's going to come with this next wave as well.
Mm-hmm.
So you reached out to NICHQ. It wasn't like HRSA put out a grant application, Boston University won the award, Texas came one. It didn't.
No, in my understanding, it's a direct contract relationship between Florida Department of Health, the Title V office, and NICHQ. So
Yes,
it's a direct
Mm-hmm.
contract.
And I would be remiss if I didn't say that one thing we're working on right now is a partnership with the MCH Workforce Development Center, which hopefully everybody who's, you know, been part of this work for a little bit has had an opportunity to be engaged with them. But what's different about this project that I really am loving is that we have a team coach. And 2 of the team coaches for this project, I think there's 8 states in it, related to, you know, quality improvement, of course, came out of our COIN. So our COIN teams had coaches, and now these coaches are, you know, doing more work through MCH. I hope your paths get to cross, but that too, you know, their expertise is helping drive improvement.
Wonderful. Oh, that sounds great. And yeah, the more all of us know about opportunities like this. Thank you, Ivy. And I do want to mention, if in case you haven't seen in our chat, that my colleague Angie Chatfield, who has been with the Department of Health much longer than me, has reminded us that NICHQ's relationship goes back all the way to 2006 with us, because they worked on a newborn hearing screening initiative. So kudos to NICHQ. So Eliza, next question we are going to throw out to everybody. I know that we were kind of curious for those who, thank you, Stacy, for putting them, that we've had the opportunity to work with the workforce development gang, and they are great. They are just terrific. So thank you for adding that in. And Ivy, yes, the QR codes they were working when we taped, and now they're not. We don't know what happened. So thank you.
Here, I'll post them in the chat.
Going to post those, and you can, if you go into the section where you can get downloads of the PowerPoints and handouts, we do have the roadmap handout in there as well. So, but she's going to also put the other few links that were a part of what we had in the presentation.
And I'll just mention the links might look a little funny, but if you do just copy and paste into your URL, they'll take you straight to those resources.
So I don't see the person who had asked the question about youth engagement in this process. It doesn't look like she came in, but I do want to speak to that for just a minute, in that, you know, in the larger scheme of things, and I'm in a lot of groups that are involved in patient and family engagement, whether it's in the hospital setting, you know, systems-wide hospital settings with what we call PFACs, patient and family councils, versus other kinds of organizations that bring together that patient and family voice. There is that inherent idea that a patient could be a young person, and or a family person. It could be a sibling who's a younger sibling voice, much less a parent or a grandparent. So there's diversity in that whole aspect of the use of the terms patient and family engagement. But you do have to do some thoughtful exploration about bringing in youth voice, and if there's any regulations. We've got all these different clinics, 32 different clinics. And so there may be some regulations that they have to consider in bringing in a youth perspective and being a part of a quality improvement initiative versus an adult. But we, you know, absolutely would encourage any of our clinics that can do that and have that capacity to include youth voice whenever possible. And as far as for us in Title V, we have a variety of what we call friend organizations or collaborative groups that we lean in on when we need to tap youth voice in kind of a focus group or survey activity. We do not have a formal youth council, but lots of different organizations we partner with where they do have that capacity. So from time to time, we are able to at least tap in from a focus group or survey kind of perspective on youth voice.
Yeah, I agree, Linda. And I'll add that I know some of the, as you said, the teams that we do work with have mentioned connections to youth advisory councils or other groups within their particular institution. So I agree that's an area of growth for us and investigation for us, and encouragement to the teams that we work with to connect with the patient and youth groups as well.
In all of the conversations that I've had, both at national level and state level too, I think it's pretty rare to hear an equality improvement project where there's a targeted youth inclusion in a quality improvement. It's not unheard of, but it's just it's less common, and that's a sadness. We need to work on that. Any other questions that have come up? Got kind of a quiet group.
Yeah, I was trying to look through the participant list and see if anyone had mentioned particular family engagement or QI initiative at their organization.
and I will say too, so I'm going to tout something else because it's a tie-in to what we're talking about. And thank you to AMCHP for letting us have access to all the presentations. There are so many that I can't wait to go and watch, even though it won't be live, but it will at least be nice archive learning to go to. But there was another session yesterday, earlier in the day, the state of Massachusetts, they have a roadmap for family engagement that they just completed and presented on. They were coming from the aspect of diversity regarding their take on this particular roadmap. But interestingly enough, they used as one of their resources for their brand new roadmap that they've put together, they used our quality improvement roadmap that we put together. So you see that, you know, everybody realizes this is a need, and we are looking to what others are doing across the country and trying to bring these good practices forward so everybody can learn from them. So that's another session I would say, if you didn't get a chance to go, that will be really great. Oh, Paige, thank you. My friend Paige, she's quick on the job.
Got it at her fingertips.
Yeah, she put that in there. That is the title of that one. And it was another quality presentation, lots of resources on their end that they were sharing out.
We have about 5 minutes, so I hope that we still have a couple of questions. Either type them into the chat or go ahead and take yourself off mute. That's fine too.
Can you tell us how your Title V program, Linda, is structured so that you're connected to so many providers? Are there clinics that are supported by Title V? How are you building and sustaining those relationships?
So
I know this helps sustain it, but just to have them in place to pull from. Thanks.
Okay. Yep. And I'm looking to see who my colleagues are online in case I need a little bit of course correction on how I explain this. But and thank you, Angie Chatfield. You should just come on.
Yeah.
Come on in. Angie is one of my dear colleagues, but we have a variety of specialty contracts across the state with all of those different clinics that you saw, and the kind of that circular graphic that was on our presentation, like HIV/AIDS and HEMOC and pulmonology, et cetera. So there are several clinics within each one of those medical specialty areas, and in each of them have a specialty contract with Title V regarding this QI initiative. And so that with that contract, they are involved with us for several years, and they grow from learning about quality improvement. I mean, they might have already been, maybe not, but that's what NICHQ is there for, is to be the extraordinary trainers that they are, and meeting all of us where we are in different places of understanding about quality improvement, and getting us all pulled together and moving forward in clinic level quality improvement projects. And then each of those areas, like HIV, has a state level project that all those clinics and that particular subspecialty are working on a statewide related project together. So there's a lot of camaraderie that's being built. There's a lot of learning within each of those different areas, as well as the cross-discipline learning, where our pulmonology group has learned so much from our diabetes group and what they're doing in quality improvement and helping our school nurses and clinic staff in schools know more about asthma or diabetes, so that they can take care of kids better during the school day. And so it's just been a fabulous, fabulous process. So with healthcare transition's been a big part of quality improvement projects with many of our clinics. And so they are considered statewide networks for access and quality. Thank you.
Snacks.
And they are, we call them snacks for short, which is kind of cute little acronym for them. But that's how structurally with this particular initiative. And I will say, just, kind of in the very broadest, Florida is one of the first states to move to that very to the place on the pyramid, the public health pyramid, where we work at a population health level. We don't do direct services. And we used to, but don't anymore. And this is one way of tackling more at the population health, is through these specialty contracts. And Eliza, you had one curiosity that we'll just throw out there in the last few minutes that we've got, because I think you had said you were wondering about measurement. I'm sorry.
I did see we had I'm not sure if they made it into the Q&A, but I saw on our in the previous discussion, we had some evaluation folks, some quality improvement folks, and family engagement specialists. And I guess I'm just generally wondering for this group to come together and think about how, what are you doing, or how are you thinking about how we measure success in the field of family engagement, family leadership. So just want to put that out in case people have resources or something you're already doing that we should be thinking about.
Yeah. And Ivy, I know what you're going to say. So
okay, say it. You can say it.
Well, maybe I'm not, I don't know, maybe I'm not reading your mind correctly, but there's a really great fairly new resource. It's called the FESAT. That is the acronym that Family Voices National, and it's a vetted evaluation tool specific to family engagement. And it's one that early on we did make all of our folks aware of that are involved with our initiative. But I think it's a good time to revisit that now that we have so many family partners involved. And it is a great resource. It has not only the evaluation tool, but where you find your gaps and where you find your needs for improvement. And then they provide a lot of ideas and resources for each specific segment of that assessment tool. And FESAT, F-E-S-A-T, can you remember what I'm forgetting what it stands for.
The Family Engagement Systems Assessment Tool.
There you go, that's it.
I think.
And if you,
yeah.
Family Voices, if you go to
I can find it and post it in the link.
Got it here.
Oh, somebody do it first?
Oh, Jerry's just putting in what it's about.
Yeah.
Yeah, thank you.
I'll get the post. We used it and piloted it in the COIN project. It's designed to measure family engagement within an organization or within a project.
Mm-hmm. So perfect for what we're doing.
Thanks,
and there you go. Thank you so much, Jerry, for doing that. Jerry was helping on an earlier session I was on. But anyway, it's so well put together, and it's starting to be used more and more nationally. And so I encourage folks to take a look at it and see how that could be of help to you. So where are we? Are we about to wrap up?
We are, and I want to make sure everyone has some transition time between this wonderful workshop and our closing plenary. So thank you so much to our speakers. That was a wonderful video, wonderful Q&A. Thank you to everyone who participated. That was a wonderful discussion. And I hope everyone will hang around for the live plenary that we have starting in about 15 minutes. And I hope everyone, I won't be able to say this personally after the plenary, but has enjoyed the conference. I think it's been a phenomenal experience. And we'll send you off on a high note with the plenary. And this was a wonderful workshop. So thank you so much to our speakers, Linda and Eliza, and thank you to everyone who's joined us.
Thank you so much for having us.
Take care.
Great to see you all.
Bye-bye now.